Good morning, everyone. Today, the press briefing will be a little different that we're going to be talking about today. We're going to be talking a lot about COVID-19, about personal responsibility across the state, some data that I'll share with the people of the state today, and where we are with COVID-19 as I speak today. So let me just start off by saying, Missouri and the Midwest region remain central to the COVID-19 wave hitting our country right now. As the cases and hospitalizations rise across the state, we continue to go back to our four essential pillars, which were in the beginning, were testing, PPE, hospital capacity, and data. All of those pillars had to be strong for us to move forward without any further actions. The truth of the matter is the hospital association capacity, the hospital capacity is becoming a problem of what we can do in the state of Missouri. And we're going to have to do everything we can to curb that issue, to do that. Staffing is the major issue. Not so much bed space, but the reality of having people to work in those hospitals is becoming a real issue. We are looking at different avenues right now to hopefully bring in some support to that. We're looking at all options as we can at the state level, whether that's through the use of military, some of their expertise, whether that's going to other states, trying to bring in healthcare workers. Everything is on the table to try to figure out solutions on the staffing challenges. The one thing I am confident, though, that the men and women that work in those hospitals, that work in those healthcare clinics, that provide this service all across the state of Missouri, will never give up. So I want Missourians to know that. They will go to work every day doing whatever the job is in hand to fight this virus, along with all of the other issues they have to face every day. I am confident of that. And we will continue to figure out ways to deal with the virus and to deal with the medical issues of everyone in this state. The reason this creates such a risk, not only to COVID-19 patients, but also anyone requiring healthcare support. For emergency situations such as car accidents, for treatment of serious health conditions. Those are all going on continually every day that we've got to be able to take care of the people of this state. The risk will become even more serious as flu season and winter comes upon us, which is why today I am extending the state of emergency in Missouri through March the 31st, 2021. Now, there's been a lot of things said in this state. One of the things that I've said all along, I will do everything I can to fight a virus, to deal with an economy, to deal with school kids, and to protect freedom. The holidays are coming. And as the governor of the state of Missouri, I am not going to mandate who goes in the front door of your home. Whatever your family is your family. Your private residence is your private residence. Government has no business going through the front door of your homes to decide how many members of your family are there, how many are not. That choice becomes yours as freedom. That is not our job to do that in state government. The question will come up today before this press conference, am I going to mandate a mask order? I have been very clear on that from the beginning, and that has not changed in the state of Missouri. For me as governor of the state of Missouri. And the emphasis that are put on by some media outlets is like I am opposed to wearing a mask. I have never been opposed to that. Never have I ever done that. What I am opposed of is mandates from this position to the people of this state. People on the local level should have a voice. You should have a voice through your county commissioners, through your city councils, through your mayors, through your county commissioners. And you as individuals should have that right. And what we did in this state is I do truly believe in local control and will continue to support the decisions that they make. But I will also tell you, as a fellow Missouri citizen, with the holidays coming, such as Thanksgiving, Christmas around the corner, it's all up to us, not government, but it's up to me and you to change the way we do Thanksgivings, if you so choose to do that, and I would recommend that. No different than my own personal family. Our Thanksgiving will not look the same as it has in years past. My in-laws are in their 80s. They both have underlying health conditions. And I am not going to expose them, and my family won't expose them to the possibility of COVID-19 where we don't have to. I suggest each and every one of you do the same thing. You know what's at risk, who's at risk, and what's important. There's been many things said about how this virus spreads, all the way from restaurants to bars to kinds of things that are in the news. But I tell you, this virus is everywhere. It's in our communities, it's in our families, it's in our businesses. Everywhere we go, the possibility of this virus is out there because it simply is a virus, is what it is. And nobody has control of that. It doesn't know the difference between urban areas and rural areas, but it does know, and we know how it affects everyday people. It's up to every one of us to decide what it is we're going to take the personal responsibility to slow this virus down. And I want to share with you this morning why I think this is so important and what I see as the governor of the state of Missouri every day, and why it's important for you as individuals to do more. And that really comes to you, not government, but to you. But if you look back 30 days ago with statistics of COVID-19 in the state of Missouri, the first 8 months of COVID-19, all the cases combined, there was more cases in October than in those first 8 months. The first half of November, the first 15 days of November, is more than the numbers of a full month of October. These numbers are growing at a very fast rate, and we have to understand that it will put a stress on the systems if we don't change the behavior of how we conduct ourselves. And I think it's important, if you look for some examples, North Dakota, South Dakota, Wisconsin, our neighbors, Iowa, Oklahoma, Arkansas, Nebraska, Illinois, all with higher cases than Missouri. Some with some of the toughest restrictions in the United States. But regardless of the restrictions, regardless of what state, the virus is rising. We're in the heart of winter, and people are going to be more close together, and they are going to be in gatherings. But we also can take the ability, each and every one of us, to stop that. You know where you need to be. You know when you can slow the virus down by not going to large gatherings. But that responsibility comes back to us as individuals and how we do that. I think it's important. These numbers that I just read to you, these states, and I'll give you an example. 30 days ago, let me use North Dakota because it's been hit to one of the hardest states. They had 371 per 100,000. As of today, they are at 1,300, over 1,300 cases. You can take Illinois, for example. They've increased. Nebraska, Iowa are jumping by double and triple numbers. What I want to reiterate today is how important this is for us to do prevention, and why today is the time to do that as individuals in Missouri to help one another out. I understand totally everybody's virus fatigue. I get it. And everybody wants so bad to go back to, quote, a normal life. We're not going to be able to do that. Not for several months. Even with the vaccine, the great news of the vaccine coming in December, which is going to be a tremendous help, will be one way to move forward. Months down from the road from that, the public sector will be receiving these vaccines. I firmly believe that. And that will be game changers, both of those events that will in the state of Missouri. But until then, this virus is out there. And we got to do everything we can as individuals to stop the virus, to help our healthcare industry, that they can meet the demands for the future to be able to do that. We will get through this. We will. We'll find a solution to this virus. The vaccines will be coming. But we, for right now, with the decisions that we make today on our personal lives, whether it be through Thanksgiving, through Christmas, we have to make those decisions ourselves. Government's not going to mandate you to do everything in your lives, nor do I want government to mandate. But you don't need that right now. You just need to take it upon ourselves to make tough decisions, to make wise decisions, and slow the spread, slow the risk. And it's not about us as individuals. It's about really protecting other people. to make sure this spread stops. And the only way we can curb that, we don't want to be like these other states around us. And to be able to protect our economy, to be able to protect our lifestyle, we have to take an action. The guidance that we will come out today, we will also be coming out with a set of guidance today that will be a public health warning for the entire state of Missouri. We will be giving guidance to the counties and the mayors across the state of Missouri to let them know where they are in the area per 100,000 people, what those cases look like in their counties. We're going to encourage them to take some sort of action to be able to make this curve happen. But at the end of the day, I'm going to stress to you again, as many people out there would like to say it's government's responsibility, it's not. It's our responsibility as citizens of this great state to take it upon ourselves to do the right thing. And I'm calling on every citizen in the state of Missouri, no matter whether you're from rural Missouri or urban Missouri, to do just that. Thank you, and God bless.
Thank you, Governor. Just want to start off. I was on a phone call yesterday with the Surgeon General, Jerome Adams, a good friend, and he said it is possible to have two truths that are present and true at the same time. So I want to start off with the first one and then go to the second one that the Governor was just referring to. The first truth is, as we look here at November 19th, 2020, we are in a much different place as far as our resources than we were back in April. Whether it be our testing, in which we're doing 18,000 tests a day on various platforms, the availability of those tests, the Binax Now, which we'll probably get about 1.8 million when we finish getting those that we've pushed out to our schools and all. So from that standpoint, we're in a much different place. When you look at our resources for therapies, we know so much more than we used to. We're not ventilating patients as we talked about doing in March and April. And so that's freed up our ventilators, but also has made us much more efficacious in treating people. We've pushed out therapies, dexamethasone and remdesivir, which we pushed out. And we have a new one, bamlanivimab, which we just started pushing out this week to our hospitals. So from that standpoint, we're in a much different place. And the other thing that we're in a much different place, as I said last week, is we see a path to a much better place now with the vaccine. Incredibly exciting news coming from Moderna and more news from Pfizer that their vaccine is 95% effective. When they look at long-term antibody response, both to people who've had the disease and from the vaccine, so far looking at it, they appear to mount a very strong response, both to the disease occurring naturally and to the vaccine, that we expect any day now, based on what Pfizer is telling us, that they will submit their EUA, that we think that'll take 10 to 14 days because they've been getting data all along, and hopefully the FDA will approve that. And then General Perna will ship out the vaccine immediately. And so we have 10 sites now in Missouri equipped to handle the cold storage of 94 degrees below zero. And following closely behind that will be the Moderna, that's only 4 degrees, which is below zero, which is a regular freezer. So we fully anticipate in the months of December and January, we will probably be able to move very quickly through our Tier 1, our long-term care facility staffers, and our healthcare providers, which speaks so greatly to what the governor was just saying about the staffing of hospitals. One of the kindest things we can do for them is to get them vaccinated. When we talk to the Missouri Hospital Association, one of the reasons that people can't work, it's more nurses than doctors and other staff, is because they're either quarantined or they're isolated with COVID. So we're incredibly excited about that. So in that standpoint here on November 19th, we're in a much different place as the governor talks about our pillars and our therapeutic options and the vaccine. We are incredibly appreciative of that. I would also remind you that it is not the vaccine that will get us there, it's vaccinations. So we're going to really ask for your help. Incredibly excited to see this week that 60% of Americans have indicated they want the vaccine. That's moving up. And we clearly know that much of this revolves around communicating about the risk. want to thank Lisa Cox in my department. We've done a great website that I hope you'll go onto our website and look at. Just go to the right where it says COVID vaccine. It answers a lot of questions. It's very robustly detailed. So I'd encourage anybody, and especially y'all, to go read that. It's really good. But I just want to, really ask your help in getting out the message how important the vaccine is. The other truth, though, is the one the governor just said, and that is for 49 states other than Hawaii, the cases are markedly increasing throughout the country. And Missouri is not immune from that. We are certainly in the middle of the Midwest and with Illinois and Arkansas and Iowa and Kansas as it moves up to the Dakotas. Our positivity rates, our hospitalizations, all those are up. So just to reiterate before I take any questions, the governor's message, that even though here we are on November 19th and we have more resources and more things in the pipeline that give us great hope, at this very moment in time, your risk of getting the COVID-19 is the highest it's been because of community transmission and cold weather and to some extent COVID fatigue. So as we go into the holidays, just really ask people to do all those things that we've talked about to avoid getting the disease. We do not want anybody in Missouri to get COVID-19. And I'm glad to answer any questions. Thank you.
Hey, Dr. Williams.
Hey.
So I was talking to an emergency doctor in Southwest Missouri, and he was talking about the wait that he's had to go through to find patients' rooms in other hospitals.
Yes.
And he brought up the possibility of some kind of hotline that the state could coordinate to streamline that process. Is that something that y'all would be interested in doing?
Well, we're looking, as the governor said, we're looking at all our options. We're also working with Kansas, Lee Norman. You bring up in our rural communities, there's several issues we've talked about. One is that in the old days with another respiratory disease, we would just help those people ventilate people. But we don't want to ventilate COVID-19 patients like other respiratory diseases like the flu. We want to use high flow oxygen. So we're working very much to help them at the point of care take care of those patients. So one thing we're in conversations with Kansas and here is making intensivists available to those doctors so that they can take care of the patients in the hospital there, because you can't, ambulances can't use high flow oxygen to transport people for an hour. And so in the old days, we'd ventilate people, but we can't do that. So that's the first thing. Then the second question or second part of your query would be, how do we use our resources to move people around? And you may have heard the term reverse triage, where if we are moving people into our tertiary care facilities in St. Louis and Springfield and Kansas City, then do we have the capacity to move people back who have recovered to some extent, who don't need the benefit of an intensivist, but can go back. So we're looking, as the governor said, everything is on the table when it comes to our hospitals, both referrals and staffing, those things that we can do, and we're even looking at that. What are all the things we could do to help all those hospitals increase their staffing? So I would tell you that we're looking all around the country at what other people are doing and listening very much to the Missouri Hospital Association about ideas they have. It's a long answer to a quick question, but I think it's a good one, and I wanted to expand on it.
Dr. Williams, yes. I just have, I wrote something down, want to make sure we clarify it. Originally, it was only 5 places in the state.
Yes.
And I believe you just said now there's 10 places that are going to be able to give this vaccine. Is that correct?
We've added 5. The federal government gave us permission to add 5 more, so now we have 10. Now they're in similar geographical locations, as you might imagine, but that becomes really important in phase 1 because we need people to travel to those sites for the Pfizer vaccine at least. Now when Moderna comes out shortly thereafter, we can distribute that throughout the state. But we are not going to let any moss gather on any vaccine that comes here in Missouri. We're going to get it out and distribute it immediately. So in the beginning, there'll be those 10 sites, but shortly thereafter, we will be moving all around so you don't have to travel to those sites. We will bring the vaccine to you.
I spoke to you briefly before we started. this vaccine will be administered without any precondition? I mean, we don't test people for influenza before we give them a shot. Will we be testing people for this disease before we give them a shot?
Well, Kermit, thank you again for that question. The final phase in the approval of the vaccine, and once it's gone through the FDA and it's gone through the Vaccine Advisory Council, it goes to the CDC to give us guidance on how to administer it. And one of the things you and I were talking about before this was one of the questions they have not answered. If you've had COVID, should you get a vaccine? And we're waiting for them to give us that answer. And then to your point, as a rule, we never give vaccines if you're sick. So if you have a fever or you don't feel good, whether it's a flu vaccine, and I anticipate that will be true for COVID too, that we would not give you the vaccine in that moment. But to answer your question, no, there will not be, unless the CDC gives guidance that I'm not anticipating, that you have to get a test to get the vaccine.
I will take two more, Dr. Williams. Philip and then Cameron.
Hi, Dr. Williams.
Hey, Philip.
For anyone who has any family outside their household coming over for Thanksgiving, can you kind of run through a little checklist, like what can you do to keep each other as safe as possible?
Yeah, Philip, I've been answering a lot of questions about that. There's some CDC guidelines for that, but let's just real quickly run through those. First of all is situational awareness. Be prepared to change your plans. If you've, one thing we advise is if you know you're going to be with somebody that maybe has comorbidities, you might want to kind of semi-quarantine yourself for about 5 days before you go. So you might say, okay, I really don't want to get COVID the day before I get on the plane. So for the next 5 days, I'm really going to just kind of be really, really purposeful about where I am. The second thing is situational awareness. If you do that and you wake up the day before and you've got a sore throat, can't taste, can't smell, and a bad headache, you don't need to go. You've got to be able to be willing to change your plans if you've become symptomatic. So that covers kind of things you do ahead of time. Check if you're going across states. Some states have requirements that you have a negative test before you go. So make sure you check into that. You can go on the state's websites and see. Then once you get there, outdoors is better than indoors. If you're traveling on a plane, for instance, or a bus or a train, wear your mask at all times. You can take hand sanitizer. The FAA is letting you take 12 ounces of sanitizer, which they normally don't do, so you can take that with you. So following those basic guidelines. Once you get there, outdoors is better than indoors. Social distance, wear a mask, and limit the size of the gathering. And so the overall message is you have to be much more thoughtful than you've ever been about Thanksgiving, and you've got to be willing to adapt. I just don't think anybody's probably going to have a Thanksgiving like they always have it. And as has been pointed out, I just don't want anybody to look back at this Thanksgiving with a very negative memory of what happened. I don't want them to look back to the Thanksgiving of 2020 and say, that was when X happened. So we want people to be as thoughtful about that as they can be.
We noticed the state's COVID dashboard no longer includes the state's method of calculating the percentage of positive cases, just the CDC's. What caused that change?
Yeah, thank you for the question. As we looked around the country, and we just have to kind of look at our peers at what they're doing, we just saw great variation in how people were reporting. And both you and others look at that and go, well, gosh, look at Nebraska compared to Missouri. So as you know, we evolved several weeks ago. We'll say, okay, we'll report out both CDC and the state. And as we've evolved even more, we just feel like for the states that are kind of consistently doing it, they're using the CDC. So we've decided just for communication purposes and simplicity just to go to the one reporting out. And it's really for having a consistent message as we looked at what other states were doing. Thank you, Kelly. Thank y'all. Be safe.
Mike Parson.
What is the deadline for the legislature to act on the supplemental before that money could be taken back by the federal government?
Well, for the CARES Act. Yeah. For the CARES Act. I'm going to say they would have until I'm not for sure that there's a deadline so much on the CARES Act. There's probably some other issues that would be pressing under the Constitution and some other avenues that we need to get done by the end of the year. But I would say before we start paying interest or having to borrow money, I would say something needs to occur probably. I'm going to guess probably OA would be better to answer this, or Office of Budgeting, but I'm going to say somewhere we've got to take some sort of action by the middle of November, I would say. December, I'm sorry, December. We're up against the timeline, I can tell you that. I mean, we got to kind of see where we're at.
Governor, I understand your hesitancy to issue statewide mandates and your preference for local control. The latest White House coronavirus task force, I think, said that Missouri was a red zone in essentially 97% of the counties, essentially statewide. At this point, would you encourage local officials to make their own decision? Would you encourage them to impose a mask mandate in their counties?
I most certainly will leave that up to the local official. I think the guidelines that come out today will be stressing the importance of wearing a mask. I think that'll be part of the guidelines we'll release later today. But we've always supported that. I want to make clear about that. We do believe that mask is a factor in how we curb this virus. But again, I think that's much more on the local levels that need to decide what's best for their communities. And I firmly believe people should have a voice in that decision.
Are there any measures that you'd be willing to take at the state level, and how much worse would things need to get to kind of trigger that?
What was the first part of the question?
Are there any additional measures that you'd be willing to take at the state level?
Well, I think every day we're trying to figure out what else we can do, whatever levels that might be. I think when you start looking at where we are in the hospital, some of the actions that we're going to take or what we're looking at now, how do we make sure we're prepared, not only just for the short term of this virus, but how are we going to make sure the health system can go long term? What are we doing 6 months from now? We know there's a shortage of healthcare workers in this state right now. So things we're doing is trying to make sure we're getting more nurses in training, more doctors that we can do whatever we can to get those people out there. I think there's moving parts every day to trying to figure out how can we fight this virus better. Again, I think it's the message you deliver today. It's making sure we do a little better job on social distancing. When I talk about people being virus fatigue, I would say that the vast majority of the people are not probably doing the things they were doing 2 months into the virus today. And I think we got to understand that this virus is picking up. We got to go back to those days where we make sure really maintain a focus on the social distancing, making sure we keep our hands clean. But I want to stress today, and I hope you will stress that as reporters today, it is all three of the issues that have to take place to curb this. It is the mask, it is the social distancing, it is the 15-minute intervals of you're around somebody. And we got to do a better job of that. We got to do a better job simply of cleaning our hands of where we go.
Hi, Governor. Going along with these previous questions, just what was your initial reaction to the Missouri Hospital Association sending you the letter requesting a possible mask mandate?
I don't think that's anything new whatsoever. I think we've heard that from time to time from different healthcare institutions across the state. I mean, I talk to infectious disease doctors every week. If you look at it from a medical perspective, they have a different view than what I do as governor of the state of Missouri. You know, I got to be able to balance trying to have public safety along with have people go back to work, people having their family lives without government dictating everything that they do. And I think it's a tough balance sometimes. But I think really not surprising. But, you know, it doesn't change anything either. I'm still going to work with the Hospital Association. I'm going to still continue to do whatever I can to support those organizations, which I've done from day one. You know, a lot of that's media and what it done. It is what it is.
Hi, Governor. Even if all Missourians take your message to heart, and hopefully they do, the cases will probably still go up for weeks from here. When can hospitals expect more staffing help to come in? I know you said you're looking at options, but when might we expect a decision or announcement from you?
Well, I think we're working on that every day. I don't want to mislead anybody in a time frame, but every day we're trying to find resources, how we might be able to utilize, just give you an example, how we might utilize somebody in training to be a nurse. How can we put somebody in a place maybe of a professional taking temperatures? How can we relieve that person and maybe just some normal person be able to walk in there and take temperatures? I mean, all of those things we're looking at, the small things to the big things. How do we get more people to be able to handle that bed space when the time comes? But you're exactly right. Even though we know what today, the virus is on a rise. So even if it gets to a plateau, what follows is that hospitalization, all the things that follow that virus of those numbers. So the next, I would say, if everybody would just really take it upon ourselves, the next 4 to 6 weeks, I think, are critical to try to change this. Nobody has the answer, the crystal ball to say where we'll be at 4 to 6 weeks. But I do know this, if we all take action, we're going to curve where this virus is going. We know that vaccine's out there. That's the good news. We know there's other vaccines coming. So I really believe as we move forward from December, that first round of vaccines, as we move to those coming months and other vaccines are coming, we're going to be able to fight this battle. But this battle is still here. It's not going away. So it's going to take all of us to do a part for several months yet.
Governor, we got 3 more questions. We got Kermit and William Kelly. So
Okay.
Kermit.
Governor, you've been dominated by life without the vaccine up to this point, but we are beginning to get questions about life with the vaccine, and there are a lot of people out there who have commented that I'm not sure about this, I don't trust this, I'm not getting that shot. And the question is, will there be some price to pay for adopting that attitude? I'm sure your position is going to be just as with masks, we encourage it, but we don't mandate it. Are you going to require a proof of vaccination in order to be able to do certain things?
Yeah, most certainly. We would hope to be able to have strong evidence in the very near future that it's working. I would hope, much like the flu shot. There's still people out there that don't want to take a flu shot. We know that, but we're not, as government, going to mandate people to take a vaccine. And I'm not going to mandate people to take the vaccine of the coronavirus. But what I hope to say is the ones that we do receive that vaccine, that when we get those results back, we can positively say, this is what's happening when you take the vaccine, and encourage it more, is what we'll try to do. And I think that's simply where we'll go.
But if they don't, will they be barred from doing certain things in the state of Missouri?
Well, I don't even know we've got to even to a decision like that. I can't imagine doing anything like that. I mean, we're not going to punish people because they don't want to take a vaccine, because they don't believe in it. I don't think that's who we are as Americans, as Missourians. I would never punish anybody because they don't want to take a vaccine. I don't foresee that happening.
Our final question,
Governor, a couple of hospitals in our metropolitan areas have discussed that they are almost at capacity. Is there any plan, or have you been discussing at all, possibly opening another alternative care site? Obviously, I know that Missouri was quite proud the last time of doing it in 11 days. Is there anything like that you're having a discussion about right now to open one? And if so, where would that be?
Right. Well, let me go back. I don't know that the alternative care site is the biggest need right now as what it was back in March and April. What's your biggest need right now is staffing, to be able to make sure we can meet the demand of the people that are going in there. We can still put up a facility in 11 days. We know that, but I'm not sure that's the most adequate way to do it right now. It's probably more of a way, how do we get more people in those hospitals to be able to meet the demand of the services that they need to do. But we are in constant conversations with the Missouri Hospital Association, with the team every day, trying to figure what is the best move forward. But I think the most important thing to go along with what you're saying is that we are doing exactly that. What is the best course of action a week from now, 30 days from now, 6 months from now? And we continue to try to find solutions for that. But right now, I will go back to what I said. The biggest issue facing those hospitals right now is just the people to absolutely be able to handle the crisis. It's about the manpower, the woman power, to be able to have those people on the ground to be able to fight this virus. So that's our number one priority. So every day we're looking outside the box, trying to figure out ways we can get more people to help.